I want to thank everyone for joining today's webinar from the Institute for Research on Poverty at the University of Wisconsin-Madison. I'm Dave Chancellor, and I'm going to be your host today. So for today's webinar, we're going to be talking about the well-being of essential workers and parents in the COVID-19 pandemic. And it's really my honor to introduce our two presenters today. So we have Professor Jevay Grooms of Howard University, hi there, and Professor Anna Gassman-Pines of Duke University. So I just want to thank the two of you for being here today. So thanks so much. Okay. I also want to thank the Office of the Assistant Secretary for Planning and Evaluation at the Department of Health and Human Services for the support of this webinar series. That said, any positions or opinions expressed in today's webinar aren't necessarily those of ASPE or the Institute for Research on Poverty. Jevay and Anna, both of you are part of research teams that sort of shifted gears at the start of the pandemic here. You'd been kind of working on one thing, and then you saw this obvious need and to sort of approach some of these questions that we've been dealing with, and especially related to working families and essential workers and parents. And I think we're interested in looking at those two groups, especially today, because of the way that they kind of had both unique challenges, but also challenges that sort of come in direct conflict with each other sometimes. And I'm wondering if each of you can kind of give us just a sense of how you've approached that in your work, and just sort of broadly how we can be thinking about this as we kind of get started on today's webinar. And Jevay, would you kind of lead us off there?
Yes, no problem. First, thank you for having me, Dave. It's a pleasure to be here with this webinar through the IRP, and I'm grateful for everyone that's here. You know, when COVID started, this project that I've been working on that's produced a few pages was with Joaquim Rubalcaba and Alberto Ortega, and we're friends, we're also all economists, and we're establishing a writing group together. And when COVID started, we were meeting regularly, and we started to discuss, wow, COVID, how is this going to affect communities of color? And we really started to think about this and wanted to understand, while it loosely relates to our research topic, right, that wasn't the driving force. The driving force was we wanted to be able to add to the conversation real world, like real time, right? We wanted to add to the conversation in real time. We wanted to understand how is COVID affecting American households, but in particularly understanding how it may have a disparate effect across race, income, gender, and worker typology. And luckily, all three of us are married, and we have the most supportive spouses because they allowed us to be on calls for 14 hours a day early in the pandemic. And really, we just kind of worked really hard to be part of a survey, and we were able to get a survey out within the first month that COVID hit. And so that's some of the research I'm going to be presenting today, looks at that first wave or the second wave of the survey that we did on COVID-19.
Okay, Anna, how about you?
Thanks so much, Dave, and thank you for having me today. My story in many ways is quite similar to Dr. Grooms. I am part of a research team that I lead with my colleague, Elizabeth Ananat from Barnard College. I'm a psychologist and she's an economist. We have an interdisciplinary team where we've been working together to understand the daily lives of working parents in the service sector. And in our case, we had started a project in fall of 2019 that was originally focused on really getting a detailed look at unpredictable work schedules for workers in retail, food service, and hotels, and how parents working in those sectors were balancing their unpredictable work schedules with their caregiving and parenting demands. And we were in the field gathering data from that sample of families when the pandemic started. And so we also were talking amongst ourselves about all of the challenges that these working parents were already facing with the new restrictions put in place by the pandemic, wondering what was going to happen. And so we also pivoted our research to field additional surveys about these parents' experiences during the pandemic. And that is the foundation of the work that I'll be presenting later on during this webinar.
Dr. Grooms, I'm going to invite you to pull up your slides now, and I want to thank both of you for just kind of offering this that introduction. But as we're doing that, I just want to more fully introduce Dr. Grooms. And so she is an assistant professor of economics at Howard University, and she specializes in public and health economics and their intersection with poverty and inequality. She also devotes a lot of energy to mentoring students and offering kind of resources to them. So if you want to check out our website, you'll see that there's a lot there. So certainly if you're a student, please do pull those up. Dr. Grooms, I'm going to turn it to you now. Thank you.
Thank you. Thank you for having me. I'm going to get straight into the slides. So start with a little background, right? We've all been experiencing COVID-19, but as of today, in the US, there's been over 468,000 COVID-related deaths. I wanted to put that into perspective. That's roughly the size of Kansas City, Missouri. There's been 27.2 million confirmed cases. And if we look back, March 13 marks when there was a national emergency declared. And by the end of March, 30 states had a stay-at-home order. And around the end of March is when we fielded the second wave of our survey that we're going to utilize for the paper that I'm going to focus on today. So the pandemic has altered the very fabric of everyday American life. Our research aims to better understand just how it has impacted the lives of American households at various levels. And we'll talk about these various levels as we get through the paper. So this first paper, and really the project and all, wouldn't be possible without my co-authors, right? We spend countless time working on the survey together and just kind of going over how we can contribute to this body of work on COVID and racial disparities. So the paper today I'll focus on the paper Racial and Ethnic Disparities, Essential Workers, Mental Health, and the Coronavirus Pandemic, which is co-authored with Alberto Ortega, who's at Indiana University, Joaquim Rubalcaba, who's at UNC Chapel Hill, and Ed Vargas, who's at Arizona State. And so in addition to this paper I'm going to talk about today, we also have a couple of other papers, one that was recently published in the Educational Researcher that includes those co-authors and Cassandra Davis, who's at UNC Chapel Hill. And I'll talk about that paper a little bit at the end, but that looks at distance learning and parental mental health during COVID-19. And then we have a paper that supplements the education paper, which looks at how schools can build trust and meet expectations, evidence from the coronavirus pandemic. And then we did some things for Brookings, and there's some newsletters if you kind of wanted a short, more concise and didn't want to read a full paper. But now getting into this paper. So what's the motivation for this paper? So as the US charts a path forward, we wanted to know how will it incorporate policies that ensure racial and ethnic equality as part of the recovery without understanding how COVID-19 has impacted Black and Hispanic communities beyond viral exposure and mortality. So first, why do we want to look beyond viral exposure and mortality? So we know that COVID-19 has impacted communities of color at a disproportionate rate, and in particularly Black communities. And so here's just a few states. So the blue represents the share of the Black community or the African-American population in that state. And the maroon represents COVID deaths, right? So when we look at Louisiana, 32% of the population of the state are African-American, but yet 70% of the deaths as of April 6th were Black. And the reason why we look at April 6th is April is roughly when our survey is fielded. So this data relates to what was going on in America and how COVID was affecting Americans when we fielded our survey. And then you can see there's also an overrepresentation in Illinois, Michigan, and North Carolina is representative, right? So Black Americans represent 22% of the population in North Carolina, and they represent 22% of the COVID deaths in North Carolina. So as of April 15th, so that was just a few states, but what does this look like as of April 15th? So of the states that collected information on race and ethnicity, right, this wasn't available for all the states. Below are the number of states which reported an overrepresentation. So the number of COVID deaths, the percentage of COVID deaths in that state exceeds the population, the percentage of individuals who are Black in that state, or individuals of that race, ethnicity in that state. So for Asians, it represented one of 19 states were overrepresented, and I believe that was Hawaii. Of the 23 states that reported COVID deaths by Black race, 18 of them were overrepresented, 0 of 20 for Hispanic. That has changed as COVID has progressed. For Indigenous people, it was 1 of 12 states. I believe it was New Mexico that was overrepresented for COVID Indigenous deaths. And then for individuals that identify as white, it was 0 of 23 states. So it's clear that there is a disproportionate effect of COVID on individuals that identify as Black or African American. And this just further demonstrates this, right? So this illustrates COVID deaths per 100,000 people in the US by race. And this was towards the end of July. So we still see something similar with this disparate effect by race and ethnicity going on, where you see an overrepresentation of COVID-related deaths for Hispanic, Native Americans, and African Americans. So now getting back to this paper. So what exactly are we interested in? So given the racial and ethnic disparities in COVID-19 cases, mortality, and exposure, we use a nationally representative survey to assess how reported mental health distress differ by race, ethnicity, and across employment status. So we did this by fielding the national panel study of COVID-19. So we were part of a larger group that fielded this survey. It was across several universities. And so the first group originally fielded the first wave in the beginning of March. And then we were able to get in on wave 2. And wave 2 was fielded at the beginning of April. In wave 2, we were able to introduce other questions. And we also were part of the survey for wave 3, and we are moving on to the next waves currently. And so wave 2 was about 3,300 observations. The observation is at a household level. 2,000 was from wave 1, and then 1,000 was a fresh cross-section. We have data down to the zip code level. And wave 2, what's unique about wave 2 is we introduced economic and health questions that weren't previously asked. So we introduced some new questions that we are able to exploit in our analysis for this paper. So the survey questions of significant interest for this paper are employment type and mental health. So we ask questions, we ask, are you in the labor force? And we give a description of what that would be classified as. Are you unemployed? And if you're employed, we ask you to further identify, is your employment non-essential? Are you an employed non-essential worker? i.e., are you working from home? Are you an employed essential worker, non-healthcare worker, sorry. Are you an employed essential non-healthcare worker? Or are you an employed essential healthcare worker? Now, I remind you guys that this survey was fielded at the beginning of COVID, when it wasn't really clear. And so we differentiated whether you're working at home or not as whether you're an essential worker or not. And now we know over time this has changed. And then what else we exploit here is we ask questions about mental health. And so we ask questions to get at levels of depression and anxiety. And so we call it a quasi-PHQ-9 because we ask 3 inventories from the PHQ-9 as used in CDC BRFIS, which I'll talk about briefly. And then we use a quasi-GAD-7, which we use 2 questions to get at anxiety. And so these are questions that well-respected surveys, right, the CDC uses to get at depression and anxiety. And so these are the exact questions we're asking. In the past 2 weeks, how often have you been bothered by the following problems? Anxiety, right? Are you feeling nervous, anxious, or on edge? Or the second anxiety question, not being able to stop or control worrying. And then for depression, we looked at little interest or pleasure in doing things, feeling down, depressed, or hopeless, trouble sleeping at night. And individuals were allowed to report on a 4-point scale, right? From not at all to nearly every day. So we're able to gauge the variation in your response. Keep an eye on the time. So before I get into our results, what are some limitations? So I'm an economist by trade, and economists love causal work, right? Causal inference. This is not causal. This analysis is descriptive in nature, right? Our goal here was to understand if there are statistically significant difference in mental health across race, ethnicity, and employment type. And while we are still working to assess some causal inference, really we think what's important is understanding if there is a statistical significantly different before we really understand what's causing that difference, right? How much does it matter what's causing it to how much does it matter that we even know that there is a difference? There could be selection bias in terms of employee type represented, right? Who takes the survey? So we weight the data. Unfortunately, Anna was fielding a survey before COVID. That is a great scenario. We were not. So we have no baseline analysis. We don't know what these respondents felt like or their anxiety level or their depression level prior to COVID. So we use the CDC's BRFIS, which is the Behavioral Risk Factor Surveillance System. So we ask similar questions from there. So we look at what were the results of BRFIS, which is done annually prior to COVID. And we compare that with our results of our survey to see if there is anything that is alarming. Also, worker typology is self-reported, right? This isn't cross-referenced with anything. So this is individuals telling us what their worker typology is. So this is our COVID response survey compared to BRFIS. BRFIS is in red, so that was pre-COVID. This was 2018. And then our responses are in blue. What we noticed is that everyone had elevated levels of mental health distress across race and ethnicity. Right, so we look at white, Hispanic, and Black in our survey because the data on Native Americans and Asian or any other race or ethnicity is just too small to be able to assess any type of statistically significant difference. So before I tell you the results of this survey, let's revisit our research question. How do reported mental health distress differ by race and ethnicity and across current worker typology? So we observe a statistically significant difference in the mental health distress of Black and Hispanic respondents in some of the worker typologies relative to their white counterparts. Results suggest elevated mental health distress for all Black workers, particularly essential non-healthcare workers. And we think of these essential non-healthcare workers as these frontline industry workers, right? Whether we're talking about bus drivers or those individuals that work at Whole Foods or Target or Walmart. And we also, our results also suggest elevated mental health distress for Hispanic essential non-healthcare workers. So I'm going to kind of breeze through the methodology, but we assess mental health distress across race, ethnicity, and worker typology by employing two models. So first, we use the probability of experiencing mental health distress across each individual inventories. So in the beginning, I showed you 5 different inventories, 2 for anxiety, 3 for depression. So here we build a model where we estimate the probability for each individual inventory. And then we build a model that gets at the severity of mental health distress. And we do that by creating scores for anxiety and depression. Essentially, but not the same thing as summing up, but finding a way to combine the scores across the 2 GAD-7 inventories and across the 3 PHQ-9 scores. And this is something that similarly that the CDC also does. We are going to go ahead and get through this, but for model 1, our logistic regression, we use a dichotomous variable. We use a categorical indicator for employment type, and we use a race binary. And then for our OLS model, which is our linear model, we transform our measures of severity to Z-scores to be able to assess that. So I'm just going to get to the actual results. So for essential non-healthcare workers, we find that individuals that identify as Black have an increase in significant levels of mental health distress across all inventories. And it ranges from 27 to 52 elevated percentage points relative to their white counterpart. And for individuals that identify as a Hispanic essential non-healthcare worker, we find an increase in significant effect across all inventories. So they have elevated levels of mental health distress that range from 33 to 62 percentage points, right? So whether you're Black or Hispanic, you are reporting elevated levels of mental health distress compared to your white essential non-healthcare workers. And for essential healthcare workers, now this is a little bit more cautionary, as we don't have a large group of essential healthcare workers that are minorities. But we did find statistical and significant results for those individuals that identify as Black. And we found this for 4 of the 5 inventories. And which was surprising, we found for individuals that identify as Black and were non-essential healthcare workers, they actually had elevated levels of mental health distress, and it was at a significant level for 3 of the 5 inventories. All right, so finishing up. So this was and these slides I will probably make available on my website, which is jevaygrooms.com. I'll post it at the end, but I'll probably make these slides available. So if you want to revisit them, feel free. This was using our severity measures, our quasi-PHQ-9 and our quasi-GAD-7. And essentially what we see here is that those individuals that identified as Black, whether they were a non-essential or an essential healthcare worker, they had elevated levels of mental health distress, and it ranged from 0.7 to 0.8 standard deviations above their white counterpart. And for individuals that identified as Hispanic essential non-healthcare workers, they had elevated levels of depression and anxiety that ranged from just shy of 1 whole standard deviation to slightly over 1 standard deviation of elevated levels of mental health distress. And right, these are significant. Results are robust to limiting the data to working age, so individuals under 65. It's robust across multiple measures of anxiety and depression. We include and exclude 5 states with no stay-at-home order. So reminder, this was at the beginning of COVID, so whether you had a stay-at-home order or not may have impacted whether you were an essential worker or not. So we excluded them. Results are robust. And we also control for perception of COVID-19 exposure. And so in the survey, we asked questions about whether you were exposed to COVID at work, whether you knew a family member or a close friend that contracted COVID or that may have passed away from COVID. So across all inventories, essential non-healthcare Black and Hispanic workers have elevated levels of mental health distress. Strong evidence that Black and Hispanic workers face different mental health stressors than their white counterparts. And using some work by Darity, this is especially important given Black and Hispanic workers are overrepresented in jobs with relatively low wages and often no employer-provided health insurance, right? Frontline industries. And we ask questions about health insurance, and we report this in our Brookings piece. For these frontline industries, we do find a disparity in who has health insurance and who doesn't, with those individuals being Hispanic, having less likely to have health insurance, and then Black. And then individuals that are white, I believe it was less than 5% report not having health insurance. So one paper that I'll just spend a couple of minutes that complements this work, other COVID-related work on mental health distress, is this paper that we recently published in the Educational Researcher. It looks at distance learning and parental mental health during COVID-19. And so here we look at this distance learning format and how it forced parents into this new teaching role that we call proxy educators. We find that parents with children who struggled with distance learning experienced elevated levels of mental health distress. And given the relationship between teacher burnout and student outcomes, we argue the importance of supporting parents during this time to improve student schooling. And so we're still working on some projects that look at mental health distress, but I think what these 2 papers tell us is that we really need to be concerned individually, but as a nation, in the mental health of our citizens, especially given the effects of COVID. Moving forward, given our findings in both projects, it is essential to ensure that pre-existing barriers in seeking mental health treatment do not further exacerbate the prevailing disparities in diagnoses and treatment of mental illnesses. Also, interventions to help combat a looming mental health crisis might focus on meeting people where they are to help provide adequate health care. So in the situation of parents, right, it may be something provided via schooling or some type of support network that schools may offer or school districts may offer to help parents cope with these new difficulties of being proxy educators. I wanted to give a big shout out to Cassandra Davis. So she became part of our research team after Wave 1, and she is the mastermind behind the education projects, right? Her knowledge and expertise on disaster and educational outcomes offered a unique framework for us to look at how the pandemic is affecting education. And so she's at UNC Chapel Hill. So we're really grateful for her. Thank you. If you have any questions, feel free to, if you're not able to, if you have any questions, feel free to email me, send me a tweet on Twitter, visit my website if I'm not able to answer them during the Q&A portion. Thank you.
Okay, thank you so much, Dr. Grooms. That was really helpful, and you're right on time too. So Anna, if you want to take the opportunity to pull up your slides here, I'm just going to introduce you quickly here. So Dr. Anna Gassman-Pines is the WLF Bass Connections Professor of Public Policy and Psychology at Duke University, and her research focuses on low-wage work, family life, and the effects of welfare and employment policy on child and maternal well-being in low-income families. So I think the end of Dr. Grooms' presentation really transitions nicely to yours. So I'm going to let you have at it, okay? Thanks so much.
Thank you so much, Dave. I really appreciate it. And thank you for a really interesting presentation, Dr. Grooms. I appreciate it so much. And I really do think our two presentations really work together to paint a picture of the extent of the current crisis for many families in the United States. So I'm going to be presenting work again that is joint work with Elizabeth Ananat, my colleague and co-author. And we were conducting an ongoing daily survey that started in the fall of 2019, well before COVID-19. We recruited a sample of just over 1,000 hourly service workers with young children. All of the parents in our sample were working in retail, food service, or hotels. So exactly the industries that would later be very hard hit by the pandemic. And we were originally focused on understanding work schedule unpredictability and worker and family well-being. And I think just to echo what Dr. Grooms was saying in her presentation, this is a group of working parents who are largely people of color. So our sample is just about half African-American and nearly 23% Hispanic, largely women who are primary caregivers of children and working in these industries without a lot of higher education. So the vast majority of our sample had a high school diploma or less. And finally, to emphasize that these were folks who were in many ways already struggling economically before the pandemic. So on average, parents in our sample reported that they had a monthly income of about $2,200 before the pandemic started. We were surveying these families using text message technology. We were asking these parents about their work and home experiences and their well-being using text messages every day for 2 weeks. We had just started re-enrolling these folks for participation in another round of this very intensive daily survey collection in late February. And we had enrolled about 700 of the parents by mid-March. So this technology is really helpful for facilitating research participation for folks who have a lot going on. They are working in service jobs, they are taking care of young children, and by utilizing technology, nearly everyone has a mobile phone nowadays that can receive and send basic text messages. And this technology allows people to answer our survey questions in a mode that's readily accessible and at a time that works for them. So you can start this survey and then stop it. If someone needs your attention, come back to it. You can wait to answer the questions until after your work shift has ended or after your children are in bed. And this really facilitates high levels of participation. And just to echo what Dr. Grooms presented, we all know that around March 14th, the day after the national emergency declaration was declared and the day after a stay-at-home order was announced for the state of Pennsylvania where these data were collected, we saw dramatic declines in both work and mental health. So on this figure, the orange line is the share of workers who are working on any given day over time. So moving from left to right is starting in mid-February and moving to the end of March. That line bumps up and down like little hills on the left of the screen because parents are slightly less likely to work on weekends than they are on weekdays. Although given the sectors, there's still quite a lot of work on weekends. And so what you can see is right after those initial restrictions were put into place, work days takes a huge hit. So right away, workers were told to stay home, had hours reduced to 0, and we see that as that orange line just plummets on the right-hand side of the screen. There is a similar story unfolding in that blue line, which is a family mental health index that combines measures of both parent and child well-being that was fairly stable before the COVID restrictions were put into place. And similarly, on the right-hand side of your screen, really dropped substantially after those restrictions were put into place. So as we were collecting these data and really seeing in real time just how quickly parents and children were affected by the pandemic, we pivoted to ask questions that were specific to these families' experiences during the pandemic itself. And we have collected data on the same sample throughout 2020. So we started much like Dr. Grooms right in mid-March. We made a quick pivot with the support of our funders, our universities, our families, to be able to field a survey in mid-March through April. That work has been published in Pediatrics, where we saw very high levels of job and income loss, caregiving burden, and material hardship. And I'll talk more about that today, as well as quite high levels of psychological distress. We fielded a second survey in May and June of 2020, and then a third survey in September through November of 2020. And so what I'll share with you are a few highlights, kind of selected findings from what we've learned through the course of these COVID surveys throughout 2020. First of all, there have just been substantial increases in material hardship during this crisis. So in this figure, I'm showing you rates of aspects of food insecurity. The blue bars are parents saying that in the last 30 days, they were worried about their family running out of food. And the orange bars are parents saying in the last 30 days, they actually ran out of food at some point and didn't have money to buy more. On the far left hand of your screen is what parents reported in February before this crisis really became full blown. And so one thing to note here is that these are already families who were struggling in many ways before the pandemic hit. So 24% of families in February said they were worried about running out of food, 22% saying the last month they had actually run out of food. And what you can see in the three sets of bars to the right is that food insecurity has increased substantially and stayed elevated throughout 2020, throughout the COVID crisis. And this has been a national concern. Families with children in particular have experienced increases in food insecurity, but these are particularly elevated given the strains that these families were under before the pandemic. In terms of family income, what we found is that among those employed, income from work has been low and stable since June. And so in this figure and the next several set of figures that I'm going to show you, the red and pinkish bars are representing parents saying that since this pandemic started, they've lost income, with the red bars being they've lost more than half their income, and the pink bars being they've lost less than half their income. And then the green bars represent either stable income in the case of light green, or an increase in income since the pandemic started in the darker green. And so even among those who are employed, income from work has gone down for many families. And that could be because even though people have kept their jobs, they have fewer shifts or fewer hours, or some of these folks may be in positions where they rely on tips. And even though they're able to get shifts, they don't receive as much in tips. And so their income has fallen, even though they are still employed. Unsurprisingly, things look much worse for those who have lost their jobs as a result of this pandemic. And this is about 40% of our sample. So among the unemployed, income losses from work have been larger and have actually grown since June. So the largest bar by far, from April all the way through November, are the folks who say that they have lost more than half their income from work since this pandemic started. And that is 60% of the unemployed as of November. In June, the supports from the government did help buffer all families from large income losses. So in this figure, the employed families are on the left hand side of your screen. And what I'm showing you there is their income from work on the leftmost set of bars. And then next to that is the income from work plus additional supports from the government. So this includes the one-time stimulus payments. This includes, for the unemployed folks, the expanded unemployment insurance. So all the ways that through the initial response, through the CARES Act, the federal government sought to support families during the pandemic. And what we can see is for the employed people, that really made a difference in terms of helping them maintain their income. They're the largest bar, the tallest bar is folks who say their income's been stable since the pandemic started. So that support from the government really did help. The same story is true for that set of bars on the right, which is the unemployed parents. Again, on that two sets of bars on the right, the leftmost is echoing how much income they've lost when you consider just income from work. And then the rightmost set of bars is adding in additional supports from the government. And here again, that really did help buffer many income losses, and especially large income losses for those families where the parent had lost work because of the pandemic. So that's the snapshot from June. But as we all know, these supports were temporary, and their support of family income had mostly faded by September. So again, the same sets of bars here. For those who are employed, things were looking reasonably stable in September, but for the unemployed folks, they had really gone back to experiencing very large income losses, the vast majority of parents reporting some amount of income loss, even considering what support there was still continuing from the government. I also want to spend a moment highlighting how challenging it has been for many families to actually receive benefits for which they are eligible. And that's been an ongoing challenge that's come up in many newspaper accounts of families' experiences during the pandemic. But one example of this to just talk through to give you a sense is this is presenting information about the unemployed parents in our sample. And so of those who were laid off, 87%, so almost all of them, tried to apply for unemployment insurance. This is the main vehicle for supporting income during spells of unemployment. And so the vast majority did try to apply for unemployment, although others said they thought they weren't eligible, which they probably were, given the expansions of unemployment insurance that happened through the CARES Act, or that it seemed too difficult. Of those who tried to apply, only 95% actually got through the process. So some of those folks who tried actually were not able to complete the entire process. Of those who successfully applied, only 62% had actually received unemployment insurance. And of those who received unemployment insurance, only 84% had received their expanded unemployment compensation through the CARES Act included in their check. So this is kind of like a funnel where a group of folks who were all laid off and should have been eligible and able to get this income support through the unemployment insurance system, many at the different steps of this process ultimately were not able to get benefits and not able to, in all cases, get the expanded benefits for which they were eligible. And echoing Dr. Grooms' presentation, these experiences are not equal across different groups. So, getting through the application process was lower among our Hispanic families, many of whom ultimately thought they were ineligible and so stopped going through the process. And actually receiving UI after getting through the application process and thinking that you were going to receive it was actually lower among our Black respondents, whose benefits for a variety of reasons were less likely to actually arrive. So there are real disparities here in terms of ability to access the programs that were put into place in response to the pandemic. Why don't these benefits reach everyone? We could have a whole conversation during the Q&A about this, but some things to highlight are that the applications themselves were designed prior to COVID to create hurdles in an effort to try to weed out people who perhaps did not need this support, ultimately creating barriers for probably the people who need it most. These systems are, in many cases, antiquated and often can't be updated to eliminate hurdles in a moment of crisis or to otherwise quickly enact more reasonable new policies. And many unemployment insurance offices are understaffed in general, and we're certainly overwhelmed at the volume of requests coming in. Additional research is certainly needed to understand where these disconnects occur and how best to address them. And then just to echo Dr. Grooms, the pandemic is continuing to take a toll on mental health. In our sample, nearly half of the parents screened positive for depression, anxiety, or both. And 17% of parents report that their children are sad or worried a majority of the time. So the implications of this work is that really more supports for working families are needed in this moment. The December extension of expanded pandemic unemployment compensation was an important step that will help the families who were hit most severely with income losses. The additional stimulus actively being considered will help even more by reaching all families. There are other things that could be considered as well, such as increasing benefit levels, like increasing SNAP benefit rates, providing increased support for administering benefits and reducing hurdles, especially during this challenging time. And to echo again, Dr. Grooms, strengthening systems for addressing family mental health. So just in conclusion, the effects of the COVID crisis on hourly service workers with young children on work, income, and well-being were immediate and striking. And the effects on these families have persisted as the pandemic has persisted. Policies aimed at providing income to families during this crisis have helped, but their reach has not been universal, and additional public supports to families will be needed. And I would like to conclude my presentation by just quickly thanking the numerous organizations who've provided needed funding for this research. Thank you again so much.
Okay, well, thank you so much, Professor Gassman-Pines. Just a reminder for folks, if you have questions that you'd like to ask our two presenters, please do continue sending those into the Q&A box. And we've got about 15 minutes here. So as a first question, I kind of want to have sort of two pieces of what the two of you presented, sort of talk to each other a little bit. Professor Gassman-Pines, you just talked a little bit about sort of variation in benefit uptake by race and just how Black and Hispanic workers had some more challenges getting access to those things. I think we're sort of thinking about some administrative burdens, things like that. And I'm just thinking about how that may contribute, sort of the frustrations over those things might contribute to mental health issues and whatnot. And so I'm wondering if the two of you can speak to that a little bit. And Dr. Grooms, would you start us out if that's possible?
So yes, it was really interesting because I saw your slides beforehand and I couldn't wait to hear them. Because while we didn't talk about this in this paper, we wrote this piece for the Brookings Institute, and it talked about similar things you said, right? We found that Black respondents reported receiving their UI benefits like a week or a week and a half later than everyone else, right? And we found Hispanic received them later too, but Black a week and a half late, right? You receive your benefits a week and a half late, your rent could have been due already. Right? This is a big, and so we found some of the similar things that you found, and I know other people have, and it is just a little bit overwhelming. I'm sorry, Dave, that was so on I really wanted to say that, so I actually forgot your question now.
I think if you are, I'm mostly just curious about like sort of how these things contribute to mental health issues and just sort of the challenges that people are having, sort of getting the supports that they need, you know? So they're obviously like being in a pandemic is stressful to begin with, but when it doesn't seem like you're able to get the kind of help you need, that seems like it's a contributing factor. So I just want to hear more about that.
Yeah, sorry. So, when you have like something on your mind and you just have to get it off before you can address something else. Something else we found in the survey. So let me take a step back. Individuals that have a lower income and individuals that identify as Black and Hispanic are also less likely to have health insurance, right? Not having health insurance is one of these barriers to seeking mental health treatment. Whether you may get mental health treatment for free or not having health insurance, right? It discourages you from seeking medical treatment. And there's a slew of other barriers, whether we think physicians or medical staff have been culturally trained, right? There's other barriers into seeking mental health treatment. So these existed prior to COVID. And I think some of these other effects are exacerbating this already prevalent issue, right? It could be, while we control for some of these, just the idea that people of Black, Hispanic, Native Americans are dying at a higher rate or contracting it at a higher rate, have higher levels of pre-existing conditions from disparities in healthcare, right? All of these things, in addition to being more likely to be a frontline worker, all of these things contribute to this. And additionally, we find in our survey, I mentioned it briefly, but it's in the Brookings post, but it is to think that almost 10% of Black frontline workers that were working through the pandemic, right? These were the individuals that were driving the buses, that were helping us bag our groceries. 10% didn't have health insurance, but they were working. And so that is astonishing. That is scary. That is something that would cause me stress to work through and put yourself at elevated levels of exposure and risk for the betterment of society, and to not simply have health insurance, right? So while I don't have any evidence in my research, just from my knowledge, I assume, yes, all these do contribute to elevated levels of mental health distress.
Okay, Professor Gassman-Pines, I'd love to hear from you if you have any thoughts on that.
Absolutely, and just I think to build on what Dr. Grooms said, there is so much that all of us are juggling during this pandemic, whether it's our own concerns about exposure, risk from the actual disease, whether it's concerns about income. Many people have experienced income losses, whether it's concerns about children's schooling and needing to oversee schooling that's all of a sudden happening from home, whether it's having caregiving burden for family members who are ill, could be, not just your children, but extended family, parents, and so forth. And these things have, in many cases, accumulated for many families. And the more of these stressors families are experiencing, the more likely they are to be having very high levels of stress and very high levels of psychological distress. We find that in our own work. And I think that's generally consistent with notions of kind of cumulative stress. The more things that pile on at one time, the harder it is for anyone to deal with. And just to also reinforce the point that in our study, these are families who were already managing a lot of stressors even before the pandemic, including unstable work schedules, a lot of challenges with balancing work and family, and low wages. And so they were already managing a lot. And then the pandemic has just added so much more burden to their plate.
Okay, thanks to both of you. We have a couple questions that have come in sort of looking at gender differences, and I think those are really interesting just because of the way, in our country, women take on a large proportion of a lot of caregiving roles, both in the family and in the workplace. And I wonder if from your own research and just, other thoughts that you might have, if you can speak to that. And Professor Gassman-Pines, would you start us off on this one?
Sure. So when we recruited this sample, we sent our research staff out into these businesses, these places of employment. So walking into retail stores, into fast food restaurants, into hotel lobbies, and just had them talk to people about the study, talk to them about what we were doing, try to find people who were working, who had a young child. And so consistent with that, the vast majority of people in our sample who identified as being the parent of a young child are women. So we have, over 80% of our sample is mothers. We do have fathers. We haven't yet looked at differences in our sample for the mothers and the fathers, but I think in general, there's quite a lot of evidence that women have been hit particularly hard during this pandemic in terms of feeling a lot of pressure to be the ones to step in and be the primary overseer of especially children's care and education. And so in our sample, for example, just under 5% of our sample actually said they left the labor force because they needed to oversee children's education or care. That's a story that we're hearing about across sectors, right? Women leaving the labor force in order to be the ones who are overseeing that care and education. So I think there is a lot more to learn going forward about gender norms and gender roles and how they've played out differently during the pandemic.
Okay, and Dr. Grooms?
Yes, I think that's a great point. There's some economic research out there that shows that even in a two-parent household, as Dr. Gassman-Pines was just mentioning, women bear the brunt of childbearing, even when it's a two-headed household and a two-income household. But also in our survey, we started to consider, what about single parents, right? Who are more likely to be single parents? And it's women of color. Right? We don't include this in our paper, but it's something that we saw. I think it was 38% of our respondents that were Black were single mothers. Or let me take that back. I'm sorry, 38% of single mothers were Black. And I think it was 20% of single parent households were Hispanic women, right? They were overrepresented. And so when we think about the effect that COVID's going to have on women, whether they're leaving the workforce to bear the brunt in a two-headed household, or they're single parents and now they're the sole proxy educator, they're the sole provider, right? They're taking on all these roles that us, even in two-headed households, can split, right? And they're taking on all these roles and incurring all these additional mental health stressors as well.
Okay. We've had a couple questions come in that have asked about sort of geographic differences or differences by region. And I think, I'm guessing one of the ways this plays out is just there's a lot of variation in state policies in terms of how they've handled some of these issues. Do you have much of a sense of that from the work that you've looked at or some of the results of your surveys? And Dr. Grooms, would you start us off there?
So unfortunately, at this point, we control for variations, but we don't find them driving a lot of our results. You know, one of the great things about our survey is it's nationally representative. One of the worst things about our survey is it's nationally representative, right? So we have 33 observations in wave 2, but, you know, they're from everywhere in the United States. Someone mentioned in the questions regional, and that's something we're working on now, maybe looking at regional and then also looking at urban and rural, because it's just really difficult for us to look across cities when we just don't have the statistical power to say anything about one particular city.
So
Okay.
I'll just add that my sample was all recruited in Philadelphia. So it is limited, but in many ways, Philadelphia was kind of your prototypical large city experience. So not New York City, where the pandemic got very bad in terms of number of infections and hospitalizations very quickly. But the progression of disease and kind of the city and state response looked kind of typical. They were experiencing cases, the cases were going up, there was quite a bit of concern. The other thing I'll mention about that setting is that Pennsylvania is actually known as a state that has done a particularly good job at facilitating access to unemployment insurance. So you might imagine that these results are a best case scenario for how access to that particular needed support has been challenging, even in a state that really works hard to try to support people through the unemployment application process. And so I think the way to think about that is really that it's a best case scenario.
Okay. For our, I guess what's going to be our last question here, we've had a question about sort of like protective factors, and I think this is a good place to end. And so, you know, I'm wondering if there are things that came up in your work that seem to help for people, that seem to make things better. So whether we're talking about policies or things on more of an individual level, you know, where's our hope lie looking forward here? What gives us, you know, some thought that maybe things, you know, that we can be hopeful about. So, Dr. Gassman-Pines, would you start us off?
Sure. So I think the thing to be hopeful about is that our work and other work on the pandemic has really shown in remarkably quickly for social science research some pretty convincing evidence that April CARES Act really helped make a difference for stabilizing families. And the evidence really is that were things perfect? No, they were not. We were still in the middle of a terrible crisis, but they made a big difference in terms of stabilizing income and therefore stabilizing families. And when we think about what is needed going forward and where we might consider supports, I would turn back to those results and to say, those supports were temporary. The need is still there, and really the way to think about it is what supports can the government provide again in order to recognize the ongoing need and continue to provide families with the dollars that they need to really support the basics like paying rent and providing their families with food.
Okay, Dr. Grooms.
What Dr. Gassman-Pines said is 100% correct, and I think hits the nail on the head. I think I would add two things. One, in general, I think some of these discrepancies we see across race were existing before COVID, right? So it's fixing these social constructs that existed prior to COVID. COVID has just exacerbated it. And then talking about education, we have another paper that kind of tries to look at when do parents report that education in schools are doing a good job? And a lot of it shows when they have direct communication with the teacher and with the schools. And when lines of communication are really clear, parents feel most comfortable and confident in the school's capabilities of meeting their child's needs.